high blood pressure. Today we're talking about high blood pressure, which is called the silent killer. And it's called the silent killer due to most people think you have symptoms with high blood pressure. And in reality, most people do not have symptoms with high blood pressure. You find out you're diagnosed with high blood pressure by going to the doctor and they do a blood pressure, or while you're waiting for prescriptions at Walmart, Walgreens, CVS, you put your arm in that automatic cuff and you see that it's on the high side. You usually don't have symptoms, and when you do start having the headache or blurred vision, you've usually had high blood pressure for a length of time. So what is high blood pressure and why is it important? Blood pressure is measuring the force of your blood going through your vessels. Our blood vessels are very elastic, and so they stretch as the blood goes through the vessels. When the force is too high going through those vessels, it gets stretched beyond a healthy limit. The American Heart Association several years ago, our normal was 120/80. And over the last 5 to 8, maybe 10 years, they have lowered what they would like to see as normal. Our new average normal at rest is 110/70, or overall below 120/80. The top number is called the systolic number, and that's when your heart's making a contraction. The bottom number is called diastolic, and that's when your heart's actually at rest and filling back up with blood. And so that number is very important to let us know how much your heart is at rest. Your blood pressure is at an emergency treatment level when we get a reading of 180/110 or higher than that. The American Heart Association several years ago broke blood pressure down into classifications. They now have what's called pre-hypertension, and that's when you're at 120/80. Usually when we see people's blood pressure at 120/80, we do not treat that. We ask people to lose weight, start exercising, and start watching their diet, especially with salt. When you get above the 120/80, and when you look at your handout, you will see the breakdown of the 120 to 139 over 80 to 89. That's when we start using some medications at that point. Then they break it down to stage 1 and stage 2. The difference between stage 1 and stage 2 that you'll see on your handout, stage 1, you're on 1 to 2 medications that control your blood pressure, and stage 2, you're on 3 or more medications to control your blood pressure. What actually happens to your body when you have high blood pressure, and why is it important to keep this controlled? If for any length of time your blood pressure is out of control for any length of time, it makes your valves throughout your body, not only your heart, they overstretch, and it can cause your vessels to rupture, which then can cause strokes or an aneurysm. It also can cause some vascular scarring that can cause tears in your blood vessels, and scar tissue builds up on the walls of the arteries of the veins. It can also make you have increased plaque buildup, which plaque and cholesterol is what causes coronary artery disease or heart disease. Over a long length of time, it can cause tissue and organ damage, especially to those kidneys. And then when it's too high for any length of time, it causes your heart to have an increased workload through your entire circulatory system. Now, people ask about low blood pressure. What is too low? There is not a specific number that is too low for anybody's blood pressure. We go totally on symptoms. When someone gets dizzy, lightheaded, feels like you're going to pass out, or your energy is so low that you can't do your normal activities in a day, you have to take rest periods or naps, then that's when we look at what's too low for somebody, and then that's when we consider lowering some of the medications. So what is low for one person may not be low for the next person. There are two types of high blood pressure. The classifications are primary, or also called essential, and then there is secondary. I'm going to talk about the primary or essential first, because 99.9% of people with high blood pressure are diagnosed with primary hypertension or high blood pressure. And what that means is we do not know why someone has high blood pressure. There's not an exact cause, what causes it, but there are a lot of things that put you high risk for high blood pressure. And when you look at your handout, you'll see that it says what makes you a candidate for high blood pressure, which are things that put you high risk for the primary or essential, but they actually are not a cause. So some examples are, you have a family history. It's a known fact through research that if you have a family history of heart disease or high blood pressure, that you're more likely to be diagnosed with the high blood pressure at some time in your life. The older we get, we find that people are diagnosed with high blood pressure. And it's because our vessels, again, do stretch at a younger age, but they just can't stretch as much the older we get. It's just like how we get our wrinkles in our skin. The wrinkles happen because the older we get, we don't have that elastic capability of our vessels, and so the wrinkles happen the older we get. That's what happens to the arteries, and that's why we get high blood pressure potentially as we get older. Also, males versus females. It is proven that males more likely are to get high blood pressure, but definitely females have it. But it's just more predominant in the male sex. People that are overweight are more predominantly have high blood pressure or put you at high risk, and it's because the bigger our body is, the more weight we have, the harder your heart has to pump to get the blood through, which causes the high blood pressure. Not being active or not exercising. And active and exercise are two different things, and you learn that while you're in cardiac rehab through one of the exercise classes. But active is very important for everyone, and not sitting on the couch being a couch potato just watching TV. But exercise also is important, a minimum of 3 up to 5 to 6 times a week for 30 to 60 minutes, so we can get that heart muscle in good shape. It's a muscle just like the rest of all the other muscles, your leg, your arms, your chest, etc. Poor diet. Sodium, everyone always asks us why I can't have salt. And salt is not just about the salt shaker. We do ask you to take the salt shaker away and use Mrs. Dash or the no salt added. But please do not use like Morton light salt, because that is a potassium replacement. So you can't use any of those type of substances. So it's no salt, and the product that's called no salt or new salt, NU salt, is also a potassium replacement, and that is a product you cannot use because it's a potassium replacement also, and that will get your potassium too high in your blood. So it's actually not using the salt shaker, but what's also important about the no salt, what sodium does to us is make us all retain water, and when we retain water, it makes us gain weight. Possibly you will see a weight gain 3 to 5 pounds in a 24 to 48 period of time. And when you're coming to cardiac rehab, we do ask you to weigh every day, and we are looking to see if there is too much of a weight gain with our open hearts or congestive heart failure patients. When you weigh in on a Monday at 150 pounds and maybe on Wednesday at 155 pounds, that is not because you overate too much food. That is totally from too much sodium if you ate out at a restaurant or you ate fast food, or you actually had too much sodium in what you cooked at home. The American Heart Association, as well as the American Dietetic Association, lowered the standards for sodium. It used to be 2,000 milligrams in a day, and it is now down to 1,500 milligrams in a day. One way I like you guys to understand how difficult that can be is several years ago I went to the grocery store to buy me some skinless, boneless chicken breast. And I was buying, I'm only using the Tyson brand because that's the most popular brand out there, but it's any brand. And I looked at the package of skinless, boneless breast, and one breast in the store before anything was put on it had 350 milligrams of sodium in that. And I'm telling you, you can only have 1,500 milligrams in a day. Well, several years ago, sitting right next to your Tyson chicken or Crystal Lakes chicken, they now have what's called Smart Chicken. And unfortunately, it is twice the price, and it doesn't go on sale as often. But one chicken breast that is boneless and skinless out of Smart Chicken only has 75 milligrams of sodium. The reason that is when this meat comes into the stores, they have to inject with preservatives before they throw it into the deep freeze to prolong the shelf life. And what they're injecting with is sodium contents. So that's where your 350 milligrams comes from. What you will notice, a lot of people say that Smart Chicken is more expensive, and we know, and you all will find out as you are seeing the dietitian while you're in cardiac rehab, it's very expensive to eat heart healthy. But how I look at the Smart Chicken is, yes, it may be $6 more a package. So a package of chicken could be $12 and your Tyson is $6. But in reality, it's really the same price, because on Smart Chicken, it is twice as big and thick, and it does not shrink when you grill it, bake it, however you make that chicken. But because the Tyson or Crystal Lakes, it has a lot of sodium in it, when you pull it off the grill or you pull it out of the oven, it shrinks in size because of all the sodium. And so one chicken breast of that Smart Chicken is actually can feed 2 people or be a second meal. So reality, yes, you're paying out the double price, but at the same time, it's really the same price when you cut it down on how many meals you get out of Smart Chicken. The other factor that feeds into making you a candidate for high blood pressure is people that drink too much alcohol, that do not drink on a social level. The definition of social drinking is 1 drink for a female, 2 for a male, daily. People that drink more than that on a regular basis are more prone to high blood pressure. The next thing that makes you a candidate is it is a fact that the African American culture is high risk for high blood pressure at some point in their life. It's a disease process that happens in their culture, and they do know that at some point in their life they may end up with high blood pressure. Some other contributing factors that cause high blood pressure is stress, and we all go through different stress in our life, if it be financial, divorce, a death, health issues, but it is getting that stress under control more quickly and learning what we can change and what we can't change in life. But long-term stress will cause high blood pressure. Smoking is another factor that causes high blood pressure, and one thing I always like to stress to my smokers that are either not ready to stop smoking or just don't want to quit. It's not that we all are non-smokers and that we want to harp about you need to quit smoking. It's about what smoking does. One, it is a statistic through the American Heart Association that 90% of patients return with another heart attack or stent or possible bypass within the first year if they do not stop smoking. Now, why does that happen? When you smoke, you breathe in carbon monoxide, and when you breathe in carbon monoxide, it thickens the blood. So you're fighting against medications that you're on, such as aspirin that thins the blood down, or some of you may be on Plavix or Brilinta that keeps your platelets from getting sticky and causing blood clots in your arteries or in your stents. So you're fighting against those 2 medications to keep your blood thin as it's circulating through your body. The other thing that carbon monoxide does is, again, our vessels are very elastic, so they stretch. Well, it makes it so our vessels lose the elasticity, so they can't stretch. So where your vessels were stretching and staying wide open, they start going down around the stent or possibly in new areas of the heart and making some blockage go on. So those are the reasons why smoking is so important. And secondhand smoke has been proven to be worse than you being an actual smoker, and those studies are continuing with the American Heart Association, but secondhand smoke is just as bad, if not worse, than smoking a cigarette. The other thing that's a contributing factor is people that either have sleep apnea or have not been diagnosed with sleep apnea. And sleep apnea over the last several years is getting a lot of attention with the American Heart Association because the heart and lungs work together, and they have found that people that have sleep apnea untreated or people that do not use their CPAP or BiPAP are more likely to get heart disease. And it will cause high blood pressure because sleep apnea means that we are stopping our breathing multiple times throughout the night, so you're not getting proper oxygen circulating through your system. So people that are supposed to be wearing CPAP or BiPAP, it's so important to get that and wear that. And if your mask or cannulas are not working, you need to call the company and have them come out and refit you to make it more comfortable, so you will wear your CPAP and BiPAP. Now, those were all things that are contributing factors to primary or essential high blood pressure, but again, they don't cause, just put you high risk. Now, less than 1% of people have what's called secondary hypertension. And that means we find a medical cause for your blood pressure problems, we fix that medical problem, and then you no longer have high blood pressure. So an example is when we send you to the cath lab and take the catheter through your leg and go up into your heart arteries, we see the blockage of those arteries. Well, we can do the same thing in your kidneys. The kidneys is the big foundation of how that whole blood pressure comes about. And we can look, if we find that you are taking your medicines properly and you're watching your sodium and we still can't find why your blood pressure is out of control, they possibly will do an ultrasound or take you to the cath lab and look at your kidney arteries. And sometimes they find blockage in those kidney arteries. They put stents in those kidney arteries. We open them up, and then we no longer have that problem. Sometimes people get a tumor on their adrenal gland. We go in, we remove that tumor off the adrenal gland, and now you no longer have high blood pressure. I use my mom in this example because she has secondary hypertension, but she's kind of off the normal in the sense of she's always going to be treated for high blood pressure because she has a medical reason that we know, but it's something that it's not possible to treat. She didn't have high blood pressure till she was 68. They continued to do tests to find out why she was so uncontrolled, even though she was taking her medicines correctly. And they did a sonogram, and they found that she was born with one kidney smaller than the other. So we can function off one kidney, and it never affected her in younger years. But again, the older we get, our body just starts changing. And so once she got to age 68, her smaller kidney wasn't working as well, and her good kidney was overworking. So now she's on high blood pressure medicine, but it's not like we take that kidney out or anything. So it's just a problem. We do know the medical cause, but unfortunately hers is a type that will be treated with medicines. Now, medications. This is where you guys learn about some of the medications that you're on, and because pharmacy talks about all of the different medications, I'm only going to be specific on 4 that most heart patients are on. This is important because I find in this class is when you guys might be taking your medications wrong. The first class of medications is called diuretics, and those are the ones that make you pee a lot. Our congestive heart failure patients are usually always on those type of medications because their heart isn't strong enough to move the fluid on through, and so we need to give them an extra help so they don't retain too much fluid. Most patients, unless you retain water, are not on these medications unless you are someone that retain fluid because they do have different side effects. We do have to watch our kidneys closer, and it does cause impotence in males, and so we try not to cause problems that will make patients not want to take their medications. So that one's only on a small portion of our patients. Beta blockers. 99% of all heart patients are on a beta blocker, and you will recognize this. You're either on toprol, metoprolol, low pressor, Carvedilol, Corag. Those are the main drugs that we use here at Truman. And the one thing I want to say about beta blockers, they're high blood pressure medicines, but they're heart medicines. And I'm going to separate these out when I talk about toprol or low pressure metoprolol. Those are all the same medication. It just depends on the company that makes it. And Carvedilol and Corag is the same medication. One thing, this is a heart medicine in the sense of it makes it so your heart doesn't have to work so hard. It takes the demand off your heart. It slows your heart rate down but brings your blood pressure down, and it makes so your heart doesn't ask for so much oxygen. A beta blocker actually does work for your heart, so it allows your heart to rest. These are considered secondary prevention drugs, and what's been shown through studies is if you are to have a heart attack in the future, people that are on beta blockers more likely survive a heart attack. So they are very important drugs. Now, these are medications you are never to run out of. You're not supposed to skip these medications. And what happens when you run out of these medications, because it is the medication is doing part of the work for your heart so your heart can rest, is when you run out of these medications is your body gets a surge and your heart all of a sudden has to overwork. Your heart rate will go up, your blood pressure will go up, and that's the exact opposite of what we want to see when someone has a heart condition. So it's important to watch how many pills you have in a bottle. Get it called in so you get it refilled. People that use Truman Pharmacy needs to make sure that they're on top of it, of getting it filled before the weekend, since the Truman Pharmacy is not open on the weekends. And our Walgreens here at Truman is closed on weekends and holidays, but we are contracted out to a few Walgreens out in the community that you can get on weekends and holidays. But you need to be sure you're on top of that. When your bottles say no refills, it's important to be watching that so you can still call your refill into your pharmacy. The number's on the bottle. They will contact your doctor and then get it approved for you to have refills again. While you're in cardiac rehab, myself or another nurse that may be filling in can help you with those refills to get them filled. But you never want to run out of those medications. If you do forget a medicine, you do not double up on those medicines, and we've had patients do that mistakenly and your blood pressure will go too low. So please never try and catch up if you forget. Now, if you take metoprolol or toprol once a day, I'm going to teach you some guidelines on how to take that. And if you take the toprol twice a day, I want you to listen when I talk about the Carvedilol and Corag, because that medication is taken twice a day. But before I explain both of that, what's important about blood pressure medicines is what I'm finding with cardiac rehab patients is a lot of patients don't take their medicines at the same time every day. These medications are time released, and you must take them about the same time every day. If one day you take your medicine at 6 o'clock in the morning and the next day you take it at 10 o'clock in the morning and the next day you take it at 6 o'clock in the morning and then 8 o'clock, we will never get good control on your blood pressure. And the caution on that is, I'm watching a blood pressure minimally 3 times in a row before I contact your doctor, because blood pressure goes up for different reasons. You may be rushing in from the parking lot. It may have been stressful driving here. You may be upset about something that you're holding in, so your blood pressure can be affected. So we will monitor it for 3 days in a row before we contact your doctor. After the 3rd day of your blood pressure being up, I will contact your cardiologist and ask him how he would like to change your medication. The problem, if he increases your medication and then all of a sudden you decide to start taking it about the same time every day, and we get it more regular, with that increase, we could actually get too low of a blood pressure. So that's why it's important you take this every day, since I will be contacting the doctor. So to explain to you about the same time every day, I always like to explain this on how nurses do this in the hospital. A nurse gives morning medications. It's scheduled for 9 a.m. We are allowed to start giving that 9 a.m. med at 8 a.m. and we can give it as late as 10 a.m. So we have an hour window both ways. That's how I want you guys to decide how to do it, what will work best for you while you're at home. The problem is weekends count, and a lot of people like to sleep later in the weekend. So you've got to make it consistent for 7 days during the week. But the medications such as Toprol, if you take it twice a day, or your Corag twice a day, you've got to make it so it's in your sleep pattern, so those two pills are not taken close together, because if you're taking it twice a day, they should be 12 hours apart. They are slow release medications. So make sure that you decide how you can take it with an hour going each way of what works best for you. If you forget a medication and you take Toprol once a day, and you normally take it at 8 o'clock in the morning, and at noon you say, oops, I forgot. At noon, go ahead and take that medication. But much after noon, do not take that medication. You're just going to kind of have to bite the bullet and know that your heart rate and blood pressure for that day and probably the next 1 to 2 days will be a little higher, because if you take it at 2 or 3 in the afternoon, it will overlap with it when you take it again in the morning. So just don't take it if it's much past noon. If you're on Toprol twice a day, or you're taking the Corag, which is automatically prescribed twice a day, if you take it at 8 o'clock in the morning and you remember it much past 10 o'clock, don't take it, because it will overlap with your night medicine. Or if you decide to take it, make sure you move your night one a couple hours later so it doesn't overlap due to the slow release. So you would skip your morning one and just take your night dose. But do not take 2 pills of what the prescribed dose is, so you don't get too much of that medication. Again, please.
Sorry.
That's all right.
Oh. Okay.
Please do not catch up on that medication. Just bite the bullet if you do run out, or if you forget to take. Do not run out of these medicines. I'm going to talk about the next 2 classifications together, because most people do not take both, and some people don't take either. ACE inhibitor is anything that ends in pril: lisinopril, acupril, quinapril. Those are the 3 medications we prescribe here at Truman. Those are a blood pressure pill, and they are a heart pill. They definitely lower the blood pressure, but what it does for the heart is help the squeeze or the contraction of your heart. So a lot of our patients are on those, and anybody with diabetes is on those medications because it's a secondary prevention drug. Do not take that drug at the same time as your beta blocker, so your Toprol or your metoprolol or your Corag. Do not take those medications together. They must be separated by minimally 2 hours. Now, I use myself as an example. If I was prescribed a medicine and someone said take it 2 hours later from another med, I would not remember unless I set my cell phone for the alarm to go off. So I tell you to take your beta blocker in the morning or at night, and then take your ACE inhibitor or your ARB. Your ARB is either losartan, Atican, Cozar, and you're either on an ACE inhibitor or an ARB if you're on one of those medications, and do not take those together. So I tell people to take your ACE or your ARB at lunchtime because at some time you're slowing down again, you're going to eat, and easier to remember. But the most important thing, if you're going to take them and you do remember 2 hours, then you can take them 2 hours apart. That's the most important thing. Now, the ACE inhibitor, which is lisinopril, quinapril, or acupril, the most common side effect of that is 20 to 25% get a dry, nagging cough. You never cough anything up, but you're clearing your throat a lot, and sometimes it keeps you up all night long. We like to keep you on that medication and see if you finally get past that, but if it makes it so you can't sleep and you are just very tired from coughing all night long, we will take you off that medication, and then that's when we move you over to an ARB or the Cozar, losartan, or Atican, because that medication does not have that side effect and your cough automatically goes away. Again, these medicines do not run out of. They again have to be taken the same time every day. Now those are the only medicines we're going to talk about, since pharmacy does talk about the rest. So the things we want to stress about high blood pressure is taking your medications as scheduled about the same time every day. Watch your sodium, exercising 3 to 5 times a week. While you're in cardiac rehab, Amanda or Dennis will tell you when it's safe to start doing your home exercise outside of cardiac rehab, and they will help you know what's a safe level to do. Watch the alcohol intake. Do that only in moderation. We encourage the stopping to smoke as well as losing weight. The most important thing is, if you do keep track of your blood pressure at home, make sure you document the time of day you're taking your blood pressure, because it does make a difference if you're taking it in the morning, afternoon, or night. Everybody's different on how their high blood pressure is. And document if it's on the right arm or left arm, because some people are higher on one arm. And when you do come into the doctor, please bring that log if you are watching that, because that gives them good information, especially when you're not in cardiac rehab. They see your blood pressures while you're here, but when you're not here, that allows them to see how controlled you are.